is a yeast diaper rash? A yeast diaper rash is different than regular diaper rash. With a regular diaper rash, an irritant causes the rash. But with a yeast diaper rash, yeast, candida, causes the rash. Yeast is a living microorganism. It naturally lives on skin but can be hard to tame when there's an overgrowth. Anyone using a diaper can develop a yeast diaper rash. Keep putting to learn how to identify, treat, and prevent this type of diaper rash. How to identify a yeast diaper rash. Yeast diaper rashes require different treatment than a standard diaper rash, so it's important to be able to identify the type of rash. Yeast diaper rash symptoms compared to regular diaper rash symptoms. Regular diaper rash shows pink to reddish skin that's smooth or chapped, whereas yeast diaper rash shows with red skin with dots or pimples. Yeast diaper rash doesn't respond to standard diaper creams and takes a while to treat. But regular rash responds to standard diaper creams and clears up in 2 to 3 days. Yeast diaper rash may occur more in the folds of legs, genitals, or buttocks. Meanwhile, regular rash may occur on smoother surfaces of the buttocks or on the vulva. Yeast diaper rash may occur along with thrush infection in baby's mouth. Regular rash doesn't usually occur along with oral thrush. Yeast rashes may have satellite spots of rash outside the border of the rest of the rash. But regular rash is localized to one area. What causes a yeast infection in the diaper area? Yeast can be present on the skin and in other parts of the body with no symptoms or negative effects. However, if the yeast overgrows, it can cause an infection in the area. Overgrowth often happens in warm, moist areas or where a regular diaper rash already exists. How to treat a yeast diaper rash at home. The following home remedies may help treat the infection. Keep the area clean. Gently and thoroughly clean the whole diaper area every time you change the diaper. It can help remove yeast and also reduce the risk of other infections. It's also important to thoroughly wash your hands and anything your baby laid on during the diaper change. This can help prevent the spread of the yeast. Keep the area dry. Change your baby more frequently. Yeast thrives in warm, damp areas, so keeping the area dry can help stop the spread of the yeast. In addition to more frequent diaper changes, also allow baby's bottom to air dry between changes. Gently pat the area dry, but avoid rubbing, which can further irritate the skin. Go up a diaper size. Too tight diapers can keep moisture closer to the skin. By temporarily going up a size in diapers, you can reduce irritation and moisture to the existing diaper rash. You may also need to change your baby's diaper during the night to keep excess moisture at bay. Have diaper-free time. This can get messy, so consider having diaper-free time in areas of your home that are easy to clean, or put a towel or play mat under baby to help catch any messes. To further reduce the risk of messes, have diaper-free time immediately after a diaper change. If baby has recently gone to the bathroom, they're less likely to need to go again anytime soon. For younger babies, you can do diaper-free time during their usual tummy time. For sitting babies, place books and engaging toys around them to try and keep them entertained on the towel. Avoid irritants. The infected area will be tender. Irritating products can make discomfort worse, like soap and bubble bath. You may also want to hold off on using wipes during diaper changes. Instead, use a clean towel that's been dampened in warm water to clean the diaper area. Use anti-fungal creams. The above measures can help treat the symptoms of a yeast diaper rash and may help it to go away faster, but most yeast rashes need further treatment. Ask your doctor about using an antifungal or yeast cream. Many can be purchased over the counter. Ask your pharmacist or doctor for specific instructions, such as how often to use each day and for how long to use the treatment. You can also ask your doctor about applying gentian violet. This is a dark purple ointment known to kill yeast, but it may not be as effective as other antifungal treatments. If you do use it, be very careful when applying, as it stains clothing. Are natural remedies safe to use? Ask your doctor before using natural remedies like vinegar or oils. Natural doesn't always mean safe.
If your doctor gives you the okay, remember that a small amount goes a long way, so be sure to dilute products well.
Does baby powder help? There's mixed information about whether or not it's safe to use baby powder to try to keep the diaper area dry and help prevent a yeast rash. Many believe yeast will feed on cornstarch. Cornstarch is the main ingredient in many baby powders. However, baby powder hasn't been shown to treat a yeast diaper rash that's already present. In fact, it's not recommended to use baby powder on children, as inhaling it can damage their lungs. Most diaper rashes should improve after 2 to 3 days of treatment. However, yeast infections can take several weeks to heal since the yeast is a living organism that needs to be killed. You'll know your baby has recovered once the rash has disappeared and the skin is healed. Call your doctor if diaper rash is persistent, doesn't improve, gets worse with treatment, or is very painful. How to prevent yeast diaper rash. The steps to prevent a yeast diaper rash are similar to many of the steps you can use to treat it at home. Diaper rashes are very common since diapers are often warm and moist. Keeping your baby clean and as dry as possible is the best way to prevent rashes and a yeast diaper rash. Consider these preventive tips. 1. Regularly bathe baby in warm water. Clean their diaper area each time you change their diaper. 2. Change diapers often. Avoid leaving baby in a wet diaper. 3. Let baby's bottom air dry for as long as possible after every diaper change. Patting baby's bum with a soft cloth or using a blow dryer on the cool air setting may help speed up the process. 4. Give baby regular diaper-free time. 5. Don't use rubber pants or diapers that prevent airflow. These can trap moisture near skin. 6. Consider using a diaper cream to help protect your baby's skin. Creams provide a barrier from urine and stool, which can irritate skin and make it prone to developing a rash. 7. Avoid baby products that contain fragrances and dyes, such as lotions or soaps. These additives can irritate the skin. 8. Don't give baby unnecessary antibiotics, as they can cause an imbalance of healthy bacteria and yeasts in the body. That has been ways to identify and treat a yeast diaper rash at home. If you got any value from this video, hit the like button. Subscribe to the channel and don't ever forget, you know how to mom.